If you or someone you know relies on Social Security or disability benefits, then you want to know about the 7 big changes that have already happened in 2025, some of which took effect on April the 14th, 2025. That is the date when the Social Security Administration rolled out sweeping changes that affect seniors and people on disability regarding how they apply for benefits, access their benefits, make changes to their benefits, and how they interact in general with the Social Security Administration. So I'm going to give you all the details. And then there is breaking news. You've heard talks about Social Security increases all year, and sometimes it's just clickbait. What is the realistic chance that President Trump is going to approve or push for a Social Security increase this year? Well, there are 7 proposals in front of the president, 2 of which are looking really good about increasing Social Security benefits, with the average being $200, but up to $500 a month. I'm going to walk you through all the proposals so that you stay informed. And I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been creating content to help seniors get the retirement benefits they deserve. We have created websites on Social Security, Medicare, Medicaid, food stamps, and now we're adding video content. And I'm also an adjunct professor. I teach finance to graduate students at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. I really do appreciate your support. And as always, I want to know where you are watching this broadcast from. So do me a favor, go into the comments. Let me know your city and your state. But let's dive in. There's been a lot of changes regarding Social Security benefits, and a lot of seniors and people on disability are simply not keeping up because there's been so much activity happening. And I have the 7 big changes, some of which took effect on April the 14th. The biggest ones are what I want to share with you. So, Social Security provides monthly benefits to over 70 million Americans, with spending projected to reach $1.6 trillion in 2025. That's how much the Social Security Administration pays, and that's why the Social Security Administration is so critical. Even small changes in policy or procedures can affect millions of seniors and people with disability. Now, the Trump administration has made a lot of policy shifts and have introduced sweeping reforms focused on fraud prevention, cutting administrative costs, and benefit taxation. These changes are already altering how seniors access and manage their Social Security benefits. The Social Security Administration is closing 26 local offices in 2025 and tightening, here's the big one, tightening identity checks, which will make it harder for many seniors to access in-person help or resolve issues quickly. These disruptions risk longer wait times, increased confusion, and potential payment delays. Failing to stay informed about these changes could lead to missed payments, surprise tax bills, or demands for repayment of thousands in overpayment benefits. Understanding what's changing is essential to protecting your financial security. So I'm going to walk you through what exactly is changing. The first one is the Social Security Administration is closing 26 offices in 2025, forcing millions of seniors, especially in rural areas, to travel over 45 miles on average for in-person assistance. This creates significant access barriers for those with mobility or transportation challenges. Now, there's stricter identity checks that have also been implemented. Major policy change. The Social Security Administration is implementing stricter identity verification procedures starting March the 31st to combat fraud and protect beneficiaries. These changes will significantly alter how people interact with Social Security for benefits, whether it's benefits claims, direct deposit updates, and potentially Medicare enrollment. Now, phone service is still available. This has been a place where a lot of changes are happening. They were cutting phone services. Now they brought it back, and then they cut it again, and now they're bringing it back. So here's the latest. After public backlash, the Social Security Administration reversed plans to eliminate phone-based claims, keeping this critical option open for most services. However, phone lines are expected to be busier and wait times longer due to staff reduction and office closures. And then there's fraud detection technology, which has been introduced without even any testing or announcement. And now you have to deal with it if you try to make any claims online. So the Social Security Administration's new fraud detection system flags suspicious claims for in-person review, requiring flagged individuals to verify their identity at a local office. While this may reduce fraud, it risks creating a red tape for legitimate beneficiaries. And a lot of these new fraud detection methods that have not been really tested thoroughly have caused the Social Security website to crash many, many times in the last couple of weeks. Closed for business, Social Security office shut down and staff reductions. Let's talk about that. The Social Security Administration is downsizing. The Department of Government Efficiency, headed by Elon Musk, has gone in there and run rampant, closing offices and shutting down services, firing workers. So DOGE is eliminating nearly 800 federal leases, including 26 Social Security offices, as part of a major government downsizing initiative. This will directly impact the ability of millions to access in-person Social Security services. Who does this impact the most? Seniors in states losing their only local Social Security office may have to travel out of state for help. There are some states where there's only one Social Security office in the entire state, and that is being closed. Increasing hardships and wait times. These closures disproportionately affect rural and low-income communities. The SSA is reducing its workforce by thousands, potentially dropping from 57,000 to 50,000 employees nationwide. This loss of experienced staff will likely slow claim processing and problem resolution. Now, let me talk about what I talked about earlier about closing offices. Alaska was one of those examples where they were closing the only office that was in the state. And the Alaska senator had to step in and push back. I don't know where, I don't have an update on that issue, but that is how short-sighted this is becoming. Because why would you close the only Social Security office available in an entire state? And so this is affecting real people. And I want to make sure that you understand when I make a statement like that, it is because it is a fact and it's happening. With fewer offices and employees, seniors can expect longer delays, lost paperwork, and more confusion, especially during peak months when benefits changes take effect. COLA. Let's talk about that. The Social Security is granting a 2.5% cost of living adjustment. It happened earlier in January, but let's talk about what's coming next. The COLA for 2025 added $50 per month. Some on disability were getting $35 per month. Now, on average, cost of living adjustment has been 2.6% on average over the last 10 years. So getting 2.5% is slightly lower. But here's the thing, 2026 is going to even be worse, because with the government saying that inflation is trending downwards, you should expect that your cost of living adjustment for next year is going to be even lower than 2.5%. Despite the COLA, many seniors are finding that rising prices for essentials like food and housing outpace their Social Security increases. The COLA helps, but may not fully offset inflation impact on fixed income. The Social Security Administration bases COLA on the Consumer Price Index for urban wage earners and clerical workers, which may not actually reflect actual senior expenses. If inflation spikes, seniors could lose purchasing power until the next adjustment. So what's happening is that the Consumer Price Index for urban wage earners and clerical workers is the inflation index that is used to calculate COLA. But the thing is that urban wage earners and clerical workers are not the ones on Social Security, at least not in the overwhelming numbers. And so why are they using that to calculate costs that affect seniors? That is why there's been a big mismatch in COLA versus real inflation, because seniors face certain costs that the general population doesn't face, especially prescription drugs, healthcare related stuff, and all that is not factored into the Consumer Price Index for urban wage earners and clerical workers. That's why almost every year, seniors find themselves falling behind and their purchasing power reduced because the COLA does not reflect real inflation. Seniors should budget carefully as the COLA provides only a modest increase. Reviewing expenses and planning for rising costs is essential to maintaining financial stability. Another change that is happening is tax hikes. The maximum income subject to Social Security rises from $168,600 to $176,100. And this affects 6% of American workers. This change means higher earners and their employers will pay an additional $465 more in Social Security taxes. This helps because, as you may know, the Social Security Trust Fund will run out of money in 2035, where there will be automatic 21% reduction in benefits. A way to fix that is to bring in more money into the system. And part of that is this cost of living hike. But it's not going to be enough. And I'm going to talk about 7 proposals in front of President Trump to fix Social Security, but also to increase benefits. So stay tuned. That is what's coming next. The Social Security tax rate remains at 6.2% for employees and employers. That is 12.4% for self-employed who have to pay the entire thing. And Medicaid taxes are unchanged, but higher earners may still owe an extra 0.9% on Medicare tax. Increasing the taxable earnings cap brings more revenue into the Social Security Trust Fund and could result in slightly higher future benefits for those paying into the system now. However, this measure alone will not solve the long-term funding shortfall, which is what I talked about. That is why it's important to wait and hear what I have to say about the 7 proposals to fix Social Security. The additional revenue helps, but with the trust fund projected to run out of money by 2035, broader reforms will be necessary in the future. Here's a big change that happened recently, actually last month in March. The Social Security Administration has reinstated a policy to withhold 100% of monthly Social Security benefits to recover new overpayments, reversing a previous 10% cap. This means some seniors could see their entire Social Security or disability check withheld until the debt is paid in full. From 2015 to 2022, the Social Security Administration had nearly $72 billion in improper payments, mostly overpayments, with $23 billion still outstanding as of September 2023. Many overpayments are due to agency errors, believe that or not, or complex rules. Seniors are responsible for repaying overpayments, even if, I want to emphasize this, even if the error was the Social Security Administration's fault. This is a big deal. And some have received bills up for $60,000 or more with little warning and have 30 days to pay it back. This can cause severe financial hardships for those on fixed income. And then there's congressional scrutiny. Lawmakers are considering reforms to limit how far back the Social Security Administration can reclaim overpayments. But for now, seniors must closely monitor their benefit statements and report any changes promptly. What does this all mean? So overpayments is a growing problem and affects about 3 million people a year. And the issue is that there are certain categories of Social Security and disability beneficiaries who are working and collecting benefits, and there are certain rules around reporting their earnings. So that their benefits will be adjusted. For some reason, this is not being done. Either the person is not reporting their earnings correctly, or the Social Security Administration has received the information but have not made the adjustment that is needed. So the person is continuing to receive the money, even though they should have received less money because of the adjustment that should have happened. And so this goes on for months, can go on for years. And then the Social Security Administration finally catches up to the issue, and then they send you a giant bill. And so what this new rule is doing is that it's going to stop your benefits once they send you that bill and you don't pay it back in 30 days. They'll stop your benefits and use your Social Security or disability benefits to pay back the overpayment until it's all paid off. Sometimes in this case where you're getting a $60,000 bill, it could take years. So seniors all of a sudden have their benefits taken away to pay for something that may not have been their fault or an error that was made by the Social Security Administration. And then there's new technology to fight fraud. The SSA has invested $16.5 million in new anti-fraud technology to analyze claim patterns and flag suspicious activity, especially for telephone claims. If flagged, individuals must complete in-person identity proof before they can proceed. So if you're applying for benefits or you're trying to change your benefits, this applies to you. With over 70 million beneficiaries, even a small percentage of flagged claims could mean hundreds of thousands of seniors are required to visit an office for verification, and this adds stress for those with mobility or health issues. The administration argues that these measures protect the trust fund and reduce fraud, but critics warn that honest beneficiaries may be caught up in these new hurdles and delays, and balancing fraud prevention with accessibility remains a challenge for the Social Security Administration. And then there's ongoing policy adjustment. The SSA has extended timelines and made exceptions for certain groups such as SSDI and SSI applicants who do not have to comply with these changes in terms of in-person verification as part of the application process, because if you're applying for disability benefits, you would have to go there in person anyway at some point during the process. So putting this roadblock in front of them at the initial stages of the application does not make sense. That's why they're exempting SSI and SSDI applicants from this fraud detection methods. And then eliminating taxes on Social Security. That's a key part of President Trump's agenda. President Trump has pledged to end federal taxes on Social Security benefits, which are currently taxing 40% of recipients. This could provide immediate financial relief for millions of retirees. Taxes on benefits provide about 4% of revenue into the Social Security Trust Fund. So eliminating them could make the Social Security Trust Fund problems even worse. But over the short term, while tax-free benefits could boost take-home pay for seniors, experts warn it could force benefit cuts or require new funding sources in the near future, because it's a trade-off. The Social Security Administration knows that the trust fund is going to run out of money in 2033. Some say 2034, some say 2035. The point is that it's going to run out of money within the next 10 years or less. So anything that takes even more money out of the system is going to accelerate how soon the Social Security Trust Fund runs out of money. However, this proposal by the president requires congressional approval, and it faces skepticism due to the potential impact on Social Security finances. So seniors should watch for updates, which I'll bring to you when they happen. And then expect longer wait times and more delays. In early 2025, average phone wait times for Social Security reached 2 hours and 31 minutes during peak months, with even the shortest callback times exceeding 1 hour, 49 minutes. Calling later in the day can mean waiting over 2 hours just to speak to a representative. And applicants for Social Security Disability Insurance or Social Security Supplemental Security Income are now waiting on average for 7 months for an initial decision to just receive the first decision. And remember, 30% of all disability applications are rejected. Actually, only 30% are approved, 70% are rejected. And so waiting 7 months to get through the first part of the process before you file your appeal could mean that you could be waiting 2 years to just get through the disability process. And this 7 months is double the pre-pandemic wait times. In some states, wait times can stretch from 61 days to 370 days, depending on staffing and case volume. As of February 2024, the SSA faced a backlog of 5.2 million pending actions, the highest in agency history. This backlog led to 1.1 billion in improper payments and increases the risk of both underpayments and overpayment for benefits. Efforts to reduce in-person wait times have led to jump in customers using appointments rising from 9% to 23% nationwide. While this has shortened lines in some offices by about 30 minutes, many seniors still report waiting hours for service, especially in high demand locations. So you have to pay attention and be your own advocate, because there's a lot of changes happening and you don't want any surprises. So how can you do that? Well, don't wait for problems to find you. Take charge by regularly reviewing your Social Security statements and payment notices, catching errors early. For example, if they're paying you more money than you think you should be receiving, it's important to go to the Social Security Administration and talk to them about it before you start spending the money, because you could get an overpayment situation and they could stop your benefits entirely. Catching errors early can save you thousands and prevent stressful repayment demands. And life changes fast, so you should make sure your Social Security records are up to date. Life changes happen, but you should also stay on top of reporting your address changes, income changes, marital status, etc. If those things you know are going to affect your benefits or require an adjustment of your benefits. And raise your voice. Your experience matters. Join Social Security or senior advocacy groups and reach out to your elected officials to demand fair treatment and improve services. Collective action has already rolled back harmful policies like the elimination of the phone services that Doge and Elon Musk were trying to push through. They were trying to eliminate most of the phone services, and a lot of seniors and advocacy groups pushed back, and that's why they backed off. Now, get help. Facing confusing letters from the Social Security Administration or unexpected bills, reach out to your elected official, legal aid, trusted advocacy organizations. There are experts ready to guide you through this, but you don't have to go through this alone. You should get help when it all becomes overwhelming for you. Now, let's talk about other important issues that are happening. But before we do that, there's a lot of changes happening with Social Security. There's no denying that. Medicare, Medicaid, food stamps, there's so much happening that could affect seniors, and it's so hard to keep up. Well, we are there to help you. We've created a newsletter. Go to our YouTube channel, go to the description at the top of the channel. There's a link to our newsletter, and here's our promise. We want to bring you the latest news and update, anything in and out of Congress that's going to affect your benefits. So sign up and be the first to know, because there's a lot happening that could affect your benefits. Stop missing out on your retirement benefits. Join thousands of seniors getting news about Social Security, SNAP benefits, Medicare, Medicaid, and more. Now, as I mentioned, President Trump has 7 proposals in front of him to change Social Security. 2 of them are about increasing benefits. Let's talk about it. So, where are these coming from? Well, the first proposal is the Social Security Expansion Act. The Social Security Expansion Act, introduced by Senator Bernie Sanders, Warren, and others, would boost Social Security benefits by $2,400 per year. That's an extra $200 a month for every beneficiary, including disability beneficiaries. This would provide immediate and significant relief to seniors struggling with rising costs. Now, some of you may say $200 is not a lot, but that is better than the COLA increase of $40. So I think this is a step in the right direction. The proposal is projected to lift millions of seniors out of poverty, addressing the fact that over 26% of seniors only survive on $17,500 a year. The plan funds the benefit. So to pay for this, they're going to raise tax, make sure that people who are making a lot of money and are not paying Medicare and Social Security taxes are brought back into that. So they are going to create a new $250,000 limit, because the current limit is $176,000. If you make $176,000 or less, you pay Social Security taxes. If you make more than $176,000, anything above $176,000, you don't pay Social Security taxes on that. What this proposal would do to bring in the money to fund this $200 increase is to bring a new limit of $250,000, so that when you make $250,000 or more, you pay Social Security taxes on anything above that. If they do that alone, it will also put more money in the Social Security Trust Fund, and keep it alive for 75 years, which means that all this noise about Social Security's trust fund running out of money in 2033, 2035 will be gone, because this fix alone would not only give seniors $2,400 a year in increases, but it will also extend the lifespan of the Social Security Trust Fund by 75 years. The next one, which is an important proposal in front of the president, is to put a new minimum Social Security limit. Why is this important? Well, there's a lot of seniors that are getting very little money for Social Security and they're struggling to survive. So, pending legislation in Congress, this will create a new Social Security benefit for low-income workers, ensuring no senior who worked a full career receives less than 125% of the federal poverty level, which amounts to $1,518 a month. Why is this important? Well, if you fit into this category of seniors, you're going to get $500 a month in increase, up to $500, $6,000 a year. That's life-changing for a lot of seniors. This would directly benefit seniors who spend their lives in low-wage jobs, reducing senior poverty and providing more secure retirement. And it has broad support from seniors and advocacy group because it's going to strengthen the program's role as a safety net. The third proposal, which may not be very exciting to a lot of people, is to raise the retirement age. Why would they want to do that? Well, this is how you slow down how much money is leaving the Social Security Trust Fund, and thereby extending the life of the Social Security Trust Fund. So current Republican proposals suggest raising the retirement age from 67 to 69. Remember, President Reagan increased it from 65 to 67. This change would address 20 to 30% of the projected shortfall. So it's a big deal. It's going to make a huge difference. But critics point out that the people in physical labor jobs cannot work late into their 60s. And the proposal would disproportionately affect lower income workers who often have shorter life expectancies and more physically demanding jobs. Another part of the proposal in front of the president is to slow down how much cost of living adjustment you're getting, which I think is a terrible idea. Reducing cost of living adjustment by 0.5% will impact both current and future retirees, making it an immediately effective but potentially controversial solution. This change would address approximately 30% of the long-term funding gap. So it's not it's a big amount, and it's going to help a lot. Because remember, your Social Security cost of living adjustments are taken out of the Social Security Trust Fund. So anything that slows down how much money is coming out of the system is going to help extend the solvency of the Social Security Trust Fund. But unlike other proposals, this would affect all beneficiaries, making it more equitable but potentially unpopular. The impact of reduced COLA compounds over time, which is going to reduce the purchasing power of seniors. And so this is why I think it's a terrible idea, because it's going to make the situation of seniors even worse. Proposal number 5 is the payroll tax hike for Social Security taxes. Currently, you may know, Social Security is funded by 6.2% taxes on employees and 6.2% tax on employers, who are matching what the employees pay, for a total of 12.4%. Self-employed individuals pay the entire 12.4%. The proposal is to increase it from 6.2 to 6.5 over 6 years. Why would they want to do this? Well, this is another way to bring in more money into the system to extend the lifespan of the Social Security Trust Fund. The solution has strong backing from both parties, making it politically viable, and it will affect all wage earners, which means that it spreads the burden to the entire workforce rather than targeting specific groups of people to fix the system. Proposal number 6, which probably is the smartest in terms of bringing more money into the Social Security system and extending the lifespan of the trust fund. As of 2025, as I mentioned, you only pay Social Security taxes on $176,100 of income. So if you make $700,000 a year, you only pay Social Security taxes on $176,100. If you make $1.5 million, you only pay Social Security taxes on $176,100. So the proposal is to create a new limit where if you make $176,100, you pay Social Security taxes up to that amount. And then anything over 250,000 or 400,000 or 500,000, you pay Social Security taxes on anything above the new limit. So there'll be 2-tier systems. This alone will solve a lot of the Social Security trust fund problems and save it for 75 years. And it only affects 4% of the population. So, and it will affect all wages, all income. So not only wage income, but also investment income, because a lot of wealthy people do not avoid Social Security taxes by taking their income from retirement, from other sources, from investment income, from real estate. And so they don't have to pay Social Security taxes on those realized income, and only earned income faces Social Security taxes. This will change that. So for example, if they build a 2-tier system and they created a new 400,000 and above level, then somebody making 500,000 will pay $31,000 in Social Security taxes as of last year versus the 10,400 they would have paid last year. And that's why this is important. And if you're making 50,000, nothing changes for you. But somebody making 500,000 gets to pay more taxes on a lot of their income. But if you make 50, you're paying taxes on all your income. But somebody making 500,000 is only paying Social Security taxes on a portion of their income. And that is why this proposal is so important. And then the last part of this is means testing. Means testing will evaluate income levels to determine Social Security eligibility, potentially reducing benefit for high income earners. This approach would reduce the program's shortfall by 11%. So it's not a big dent, but it is a solution. It has broad bipartisan support, and so it's politically viable and only affects 20% of the high income earners. And so it preserves the benefit for a lot of seniors. So this is the 7th proposal. So guys, I want to hear from you. I've shown you 2 proposals that is going to increase your Social Security benefits. And then I've shown you 5 other proposals that's going to help extend the lifespan of the Social Security Trust Fund. Let me know what you think about these 7 proposals in the comments below. And before we wrap up, let's talk about Medicare. If you're turning 65, you know you have to sign up for Medicare. There's a 7-month window, 3 months before your 65th birthday, 3 months after your 65th birthday to sign up. But if you're currently on Medicare, did you know that 90% of all seniors are on the wrong Medicare plan? Yes. Why is that? Because Medicare is so complicated. There's so much going on, so many changes happening. States are trying to fix issues. You know, Medicare plans are being dropped from certain states, whether you're on a supplement plan or you're on an Advantage plan or traditional Medicare. There's so much happening. It's hard to keep up. And in some states, seniors are being forced to choose between being in their doctor network, sticking with their doctor, or their health plan. And that's an impossible choice. But the problem is that there's 24,000 Medicare plans out there. And seniors are supposed to make decisions about which plan is right for them, fits their budget, fit the care that they need, the drugs that they need, the doctor network they have to be in, and then consider plan-specific restrictions, costs, etc., etc. It's impossible. That's why 90% of all seniors are in the wrong Medicare plan. And it could cost you a lot of money. $300,000 is what the average couple senior spends on Medicare during retirement. And it can affect your health. There's nothing worse than needing care and realizing that something that you thought was covered under your plan is no longer covered. So how can you sort through all this? Well, we have partnered with an amazing organization called Chapter Medicare. Guys, these guys are the real deal. Their mission is to make Medicare simple, to help you understand Medicare, to help you choose the right plan, and then help you use your benefits. And this is coming from a personal experience for one of the co-founders. Here's what he has to say. He watched his parents struggle to navigate the process of choosing a Medicare plan and wound up paying premiums that were hundreds of dollars a month more than they ought to have been. He realized that this is a terrible process and a terrible experience and wanted to do something about it. Another one of the co-founders for Chapter Medicare is an expert on Medicare. He wrote a book about it, one of the top books. And this is what he said. When I started my job as a Medicare advisor, I discovered that many Americans were getting misled into buying the wrong plans. Why? Simply because no one took the time to sit them down and explain what's going on. So that's what drives the mission of Chapter. And so there are 3 reasons why we decided to partner with them. And we've never done this in 15 years that I've been doing this. Number 1, Chapter is free to you. Their service is free, unbiased, and they are the only Medicare advisory company with access to all 24,000 plans. So they can see what's in your local area and customize a plan for you that fits your need, your budget, and the care that you need. The biggest reason why we partner with them is also number 2. They do not incentivize their advisors. Their licensed advisors are there to advocate for you because they are not being incentivized to push specific plans. And so their aim is to advocate for you and not the insurance companies. They work one-on-one with you to align plans with both health needs and your budget, and they can save you about $1,100 per year. But guys, you have to act soon because depending on the Medicare plan you're on or if you're signing up, there's a small window for you to make that change or get on that plan. So call Chapter at 539-205-2147, or you can click on the link in our description to this video or visit askchapter.org/insider and fill out a short form and they'll reach out to you. But you have to act soon. Why? These are some of the guys you're going to be talking to. When you call Chapter, these are directly from their website. These are their licensed expert advisors you're going to be talking to. There's a lot of them, and they're here to help you sort through all this. And here's what they're going to do for you when you get on the phone with them. Chapter will show you every Medicare option available to you in your local area, including detailed information about which doctors, specialists, prescription drugs, and hospitals are covered, what the copays cost, and how the plans they're showing you compares to traditional Medicare, so they can make an informed decision regarding your Medicare plan. And I mentioned they can save you $1,100 a year, so you have to act soon. Call Chapter now so that you don't become one of the 90% of seniors that are in the wrong plan. So they are trusted, Better Business Bureau A+ rating, lots of 5-star reviews online. Guys, these guys are the real deal. That's why we are partnering with them. Call Chapter now today for help with Medicare. And that's all I have for you today. So if you enjoyed and found value in what I shared, hit the like button, hit the subscribe button. If you have any questions at all, let me know in the comments below. Thank you for watching.